There are a lot of people out there who see COVID 19 as this thing that's sort of out there rather than something that poses a real personal threat. And you know the people, right? There's the younger crowd that says, I'm going to the club tonight. The parents who say, let's just get 5 or 10 of the kids together, for a small play date at the park. And then there are the aggressive anti-maskers who say, you can't make me use a mask in Costco. Well, I want to share with you how COVID 19 really hit home for me this week with the hopes that it encourages you all to stay informed and protect yourself. So stay tuned because I got the juice. Hi, I'm Dr. Elizabeth Horch Freeman, and welcome back to Sweeter the Juice. All most of us have been talking about recently has been COVID 19. Around the world, over 500,000 people have died of the coronavirus. And home to 20% of these total deaths, the US has the dubious title of being the COVID 19 capital of the world. My own home state of Florida has seen record high numbers of new infections and deaths with no signs of this tapering off. And trailing right behind the US in second place is the country that I consider my second home, Brazil, with 70,000 recorded deaths, a number that's likely lower than it actually is. But it's strange, right? Because we know that we're in a pandemic, but for many of us, it still seems slightly unreal and distant. And as an academic, I responded in ways that were distant and really more focused on my research. I published an op-ed with a friend and colleague of mine, Michelle Chagas, and I participated in several interviews and online Instagram lives about COVID-19 and Black communities in Brazil and the United States. And this involves some number crunching, right? Me rattling off statistics about mortality rates for Black people, which are about 2.6 times the rate that it is for white people in the US. And the COVID-19 hospitalizations and mortality rate for Black Brazilians is also higher than it is for white Brazilians. And all of these conversations were important, but they were still removed from my actual day-to-day reality. The gravity of all of this didn't really hit home personally until last week, with the death of my fun-loving, cowboy boot-wearing, Harley-riding uncle. That was when it got real. And it's in moments like these when well-meaning people like to say things like, it was just his time. It was just their time. But when Black people's life expectancy and their COVID-19 survival rates are so much lower than they are for white people, do they die because it was just their time? Or is this just plain old systemic racism? I mean, consider this. Black people are more likely to have pre-existing conditions, right? Heart disease and hypertension. But did you know that the stress of racism actually makes Black people more prone to infection and more prone to these diseases? On top of that, they're less likely to have access to health care, and when they do seek help, they're less likely to have their symptoms and their pain taken seriously. They're often experiencing blatant discrimination both as patients and even when they themselves are nurses and doctors. So where do we go from here? So yes, we need to self-quarantine, but this isn't just about people's behaviors. We need systemic solutions for systemic racism. In both Brazil and the US, Black people are much more likely to live in neighborhoods with high concentrations of poverty. And this impacts their nutrition, schooling, exposure to environmental toxins, and their access to healthcare. In terms of jobs, in Brazil, over 65% of domestic workers or maids are Black women. And Black people in both countries are overrepresented as essential workers, right? Bus drivers, cashiers, for example. And these positions don't afford them the luxury to social distance. And it's all connected. Because when racially segregated neighborhoods do not offer the type of education that can give Black people access to higher paying jobs, and when lower skilled workers, disproportionately Black, do not receive a living wage and are threatened with being fired if they miss work or when they demand to wear masks, this reflects and perpetuates systemic inequities. And we need aggressive policies to reform failing schools, to reform healthcare, to reform the police, to reform the way that we think about the impact of systemic racism and sexism in our society. But this takes leadership. Unfortunately, the president has dismissed COVID-19 experts like Dr. Fauci, and he calls Black Lives Matter a symbol of hate. And unfortunately, leaders in other countries are taking cues from him. Which brings me back to Brazil. The president of Brazil, Jair Bolsonaro, is literally referred to as the Trump of the tropics. Between his racist and sexist comments, Bolsonaro complained the media was blowing things out of proportion. And he argued that COVID-19 was just a resfriadinho, a little flu. And in the past, he has refused to wear a mask because he says there's no need to worry because o brasileiro, ele não pega nada. Brazilians don't catch anything, he says. But then, just a few days ago, he reported that he tested positive for COVID-19. And you know what? He's going to survive. But Black and Indigenous communities that don't have access to proper health care, sanitation, and resources, those same communities that have faced systemic violence and systemic racism for centuries, they're the ones who are at risk. Now listen, it's hard to make this juice sweet, y'all. But there are some people who have been doing it right. Black women-led organizations around the US and Brazil have organized to make issues of racism and sexism and health much more visible to leaders and community members. And the other silver lining is that these deaths are not inevitable. When powerful leaders listen to community members and experts, when they rely on data-driven recommendations, they see exceptional results. And apparently, living in a country where a woman is at the helm also helps too. Taiwan, for example, has had one of the most successful efforts in the world. They've only lost 7 people to COVID-19. Their president put into place 124 measures in January 2020 in anticipation of the spread. New Zealand, Germany, and Finland have all been highlighted for their swift closing and their risk-averse responses to COVID-19. The countries of New Zealand and Finland combined have less deaths than the state of Florida. And you know what? Speaking about Florida, Florida has 12 times as many cases as Australia and South Korea combined. But you know what? At the end of the day, all these statistics and all of this data won't change one really personal and devastating truth, which is that my uncle, the Tampa Cowboy, is gone. But it's in his memory and the memory of others who we've lost that we have to work towards systemic change, because everybody deserves to live the good life. Everybody deserves to live the sweet life, to just live. So let me know what you think of this episode. Leave me your comments below, and don't forget to subscribe. Until the next time, live the good life, live the sweet life.